welcome to another episode of the Alter Your Health podcast, your source of information and inspiration to promote the holistic transformation of your health and the health of our planet. I'm your host, Dr. Benjamin Alter, and today's guest is Dr. Daniel Chong. Dr. Chong is a naturopathic doctor who's been licensed in and practicing in the Portland, Oregon area since the year 2000, where his primary focus has been on risk assessment, prevention, and drug-free treatment strategies for cardiovascular disease. He is also a founder and lead coach at the Healthy Heart Academy, LLC, an online platform created to help eradicate heart attacks via direct consumer coaching and health practitioner education. Dr. Chong has completed training in cardiometabolic medicine from the American Academy of Anti-Aging Medicine. He is also a member of the Society for Heart Attack Prevention and Eradication, that is the SHAPE Society, and he also serves as a clinical educator for Boston Heart Diagnostics Lab. Finally, he's a contributing editor in cardiology for the Natural Medicine Journal. You can find out more about Dr. Chong by visiting his website, drdanielchong.com, that's drdanielchong.com, or by visiting healthyheartacademy.com. Today's conversation was focused on nutrition, really primarily, because that is how we prevent and reverse heart disease. We also talk about health in general, what it means to be healthy, and how to access our fullest potential of health as humans. I was really pleased to talk with Dr. Chong. It's the first nutritionally focused conversation on this podcast. I hope to have many more, and I look forward to having Dr. Chong back on the podcast. We've got a lot more to discuss, me and Dr. Chong. So before I let you go and listen onto this podcast, just a reminder to subscribe, to rate, and to review this podcast wherever you might be tuning in from. Also, feel free to share with anyone that may benefit from listening to this conversation. Without further ado, here we go with Dr. Daniel Chong. Check. Check.
Can't tell.
All right. We're good. All right, Dr. Daniel Chong.
Hello there.
Thanks for being here today. This is like the first live-ish interview
Right.
of the Alter Your Health podcast, and we're actually on Facebook Live just for the heck of it.
Hello, Facebook.
So what's up, people out there? Dr. Daniel Chong.
How are you?
Local Portland doc, specializing in nutritional cardiology, would we call it? Or what? Tell me about
it. You could call it all kinds of things. Well, I've been practicing for a while, so I definitely started out general and no particular focus other than naturopathic medicine. But always had a strong interest in nutrition. And I think what probably happened, if I can think back that far, it's been a long time.
Yeah, for those of you who don't know, Dr. Daniel is actually my elder. He's like, but I know he looks like my brother or something, but
right.
He's an old man over here.
Practice what I preach, that's what I say.
Yeah, exactly. Ageless.
Moving into my 19th year of practice here pretty soon.
So he started when he was 5.
Right, exactly. Yeah. Prodigy. But yeah, so I got really interested in blood chemistry analysis early on as well. Not going to typically do one of those without looking at cholesterol, and just started slowly getting more and more interested in cardiovascular disease and reading the obvious connections between that and nutrition, and then kind of made a more definitive decision to focus on that about 6 years ago now. I did a training through the Academy of Anti-Aging Medicine with Mark Houston, and that was my first sort of foray into very specific training, cardiovascular disease training. And since then, it's sort of evolving closer and closer to my primary specialty. Certainly what I do most of my learning on and teaching others about. So, but yeah, nutritional cardiology is not really it's an interesting way to think about it. It's certainly more than just nutrition,
of course.
But that's a good way to sort of generally state it.
Yeah, and we're going to get into kind of what that encapsulates more besides nutrition, of course. But
Right.
Any defining factors in the course of your, early practice that pointed you in that direction of the cardiovascular system? And you talked about the anti-aging medicine, but any, personal experiences with the heart?
It's interesting. I've always been somebody who gravitates towards really sort of simplified, knowable things. So I'm not a spread myself wide, jack of all trades type of person.
Yeah.
And when it comes to health and treating people and working with health conditions, I, over time, realized that I was not a big fan of, pouring my heart and soul into a treatment plan with a patient who had a very complicated, complex condition, and having them do everything I said and not get any better. And so I started getting more, sort of just gravitating more towards cardiovascular disease, because not only is it the thing that's killing more people than anybody else, to me, I view it as one of the most treatable and preventable conditions. So I got interested from that perspective versus some specific experience or whatever. I just started gravitating towards that because I was reading, not only working with my own patients, but reading these amazing research studies, et cetera. These people just literally fully reversing their disease and just with food, without even needing drugs, et cetera. So it seemed like the perfect canvas to paint naturopathic medicine on.
Totally. Yeah. I mean, naturopathic doctors obviously practice naturopathic medicine, but the whole field of natural medicine, which is, immensely deep and vast,
Right.
is, naturopathic doctors, I think there's 6,000 in the world or something, or in the country.
Is it that high?
I mean, it sounds like on some level, it sounds like a huge number, but
right,
when you compare
really
it to the number of conventionally trained doctors,
yeah.
But yeah, more and more of these conventionally trained doctors are studying functional medicine and doing naturopathic medicine. Someone asked me what functional medicine is, and I don't really, I haven't been like trained in a functional medicine program, but from my understanding, it's the way to train conventionally thinking doctors to think like a naturopathic doctor.
Yeah, that's how and the Academy of Anti-Aging Medicine is one of the sort of more well-known functional medicine platforms or whatever, and I did training before that with other, defined functional medicine practitioners who weren't naturopathic doctors, and do see a trend still continuing where it almost feels in a way that terminology is kind of taking over and sort of enveloping a lot of things, including a lot of naturopathic medicine. And in a way, I don't know that that's bad or good or no, what, I just want people to be treated correctly, whatever their background.
Yeah. I think I witness a lot of naturopathic doctors kind of feeling threatened or something, but when you think about it, we're all on the same team and our goal is one and the same.
Totally.
We're caring for people holistically in the best way possible. So back to like what you do in whether it's nutrition or beyond, how would you explain what you do to like a third grader?
I would say, like in really, if I really thought about it, I would probably tell them that I'm a prevention doctor, and they would probably not exactly know what that means, but basically the idea being, the far and away, regardless of what health condition you're talking about, it is way easier to help prevent disease than to treat it. And I don't think that there's near enough emphasis on prevention. Because, and it's mostly because of the model of medicine that's used in this country. It's disaster medicine. We wait for a problem to happen, and then we try our best to treat it, whether or not it be with drugs, surgery, herbs, nutritional supplements, dietary changes, etc. It's highly unusual for people to come to me or anybody and say, I feel great, and I want to stay that way.
I know.
But
yeah.
To me, that's the way it should hopefully evolve to. Yeah. And that's what I try to present myself as. Like, I want to help people never get to the point where they need radical, just extreme interventions. But we also are lucky enough, especially in the realm of cardiovascular disease, to have powerful medicine at our hands, mostly from within the body, if treated correctly, that we can deal with those situations, but it's just infinitely harder. And then there's one other part of that I would say is, like, I hear, as an example, and again in the world of cardiology, the classic standard of care now for diabetic patients is to be put on a statin, regardless of what their cholesterol levels are, as preventive medicine.
Yeah, and yet I'm pretty sure, not to stray off topic too much, but I'm pretty sure there's a number of studies showing that statins cause diabetes, or at least predispose someone to diabetes.
Absolutely. Yeah. And yet it's still like, oh no, we're trying to be preventive. So, but there's zero consideration for what else might be useful out there. It's just like, oh, we're going to use this. So it's not being done correctly. So I get, my answer, I would not say that to a third grader, but I would say, what I try to do is I try to help people keep from getting sick in the first place.
Yeah. Well, what you just shared about that statin diabetic patient correlation reminded me of this story when I was in clinic as a student. There was a patient who was coming in who was diagnosed with HIV or AIDS or some of that anyhow, and they were in the hospital. They had some drug overdose, and they woke up in the hospital with a diagnosis of AIDS or HIV. And while unconscious in the hospital, they were put on an antidepressant because they were presuming that when this person was going to wake up with a diagnosis of HIV or AIDS, they would be traumatized and depressed. And I don't, I don't know if they were claiming that was preventative medicine, preventing depression. But anyways, some of the things that are done in the world are kind of just scary. Upside down and backwards.
So
and
scary. So scary.
So when it comes to like the nuts and bolts of what you are most commonly like recommending for patients for preventing heart disease or treating heart disease, reversing heart disease, what's the foundation of that?
Definitely food.
Yeah.
Food is, to me, the most, it provides the best opportunity to have the most powerful impact on your health in general, but certainly within cardiovascular disease. You do it usually 3 times a day, every day, for the most part. And you got to do it. So you have an opportunity. Like, to me, every meal is an opportunity, right? So to either harm yourself or help yourself. And so food, for sure, there's a lot of details in that realm, but food is the number one tool. But it's not to say that there aren't other very powerful things that can be done and intervened with. But I would definitely say food, if that answers the question.
Yeah. Well, to just expand a little bit, when someone comes in and tells you that they're eating a healthy diet,
right,
like, what's your next question, or how, like, what is a healthy diet?
Yeah. So, I mean, these days especially, there's like seems to be an infinite number of interpretations of what a healthy diet is.
Yeah.
And, I think in the realm of health and in the realm or the subcategory of nutrition or dietary medicine or whatever, even though there are a lot of different interpretations of that, most of the groups, so to speak, would certainly agree probably on the majority of it. Don't eat junk food, don't eat processed food, don't eat highly chemical laden food, try to eat organic, try to eat GMO free, all of those things. So my answer will be sort of like all of those things understood aside, because I think there's no real controversy.
We agree there.
Yeah.
Eat food, not food-like substances.
Correct. Yeah. That's going to get a lot of people very far.
Yeah.
Severe cardiovascular disease is probably going to need more than that, So when I hear somebody come in, if I hear somebody come in and they say, I just had a heart attack and I don't want to get another one, but I don't understand it because I eat healthy, I want to know what that means. So because in my opinion, somebody who for whatever reasons is predisposed to be more vulnerable to getting such severe cardiovascular disease that they get a heart attack, they've got some tendencies that are going to require certain consuming certain things and avoiding certain things if they don't want that type of thing to progress. So it's kind of, I do very much believe in individualized dietary intake, and I don't think necessarily that the exact same diet is right for every single person, other than, don't eat Twinkies and Ho-Hos for whatever every meal or something like that. But so a healthy diet from the perspective of cardiovascular disease is really going to have to be heavily plant-based. My belief, and all of my beliefs are based on research I've seen, is that it's going to need to be pretty low in fat. It's going to need to be specifically low in oils, like processed oils, added oils, and there's a lot of controversy there as well, which we can be happy to go into. And I don't think it's definitively proven that a person has to eat 100% plant-based, i.e. a 100% vegan diet, to recover from cardiovascular disease, but a heavy plant slant, you might call it.
Plant slant, like that.
Yeah, is definitely going to be needed. And I hear people out there saying, you can treat cardiovascular disease with a Atkins diet or a ketogenic diet, and there's essentially zero evidence of that or zero proof of that.
Yeah.
And so my basic approach is I have an ethical obligation as a physician to tell somebody what is best. Like if I'm treating somebody from within the confines of nutrition, and they come to see me for that, I have to tell them what's best proven. Doesn't mean other things aren't possibly going to help somebody, but unless we know that for sure, we should not be telling people that. So in my opinion, long story short, whole food, plant-based diet, low in fat, high in fiber containing foods, especially antioxidant containing foods, is going to be a good foundation.
Yeah. That's a great, summary. And I think, a lot of people, I think vegan is a weighted term, and vegan doesn't really necessarily tell anyone what someone eats. It just tells people what you don't eat. Correct. So I would definitely prefer to use the whole food plant-based thing. But, what are your thoughts with regard to, are you ever considering the macronutrients, the percentage of fat in the diet, regardless of avoiding or restricting processed oils aside? Like, what are your thoughts
so that's a good question, because anything I do in my practice, I didn't make it up. I'm learning. I'm standing on the shoulders of the giants that figured it all out, and so even within the realm, you have a group of very well recognized, published, or heavily experienced plant-based doctors out there that have clearly had tremendous success with the patients they've been treating, and yet they do have some differences in opinions on specifically fat intake, and again, all of them are anti processed oils and refined oils and things like that, but there is some disagreement in terms of macronutrient ratios, specifically with fat. Pretty much everybody that I've ever learned from, in my opinion as well, is to keep protein relatively low, 10 to 15%. It is true that if all of your protein is from plants, the concern is lower. If somebody's eating an animal-based protein diet, or an animal protein-based diet, I would definitely recommend they keep it under 10% for protein specifically. But so then when fat comes into the picture, I don't have a specific ratio. I'm also try to be very general with my patients, and I don't want them counting ratios very much at all, and so my typical recommendation is no more than a handful of raw nuts in a day, a quarter to a half an avocado, and a couple tablespoons of a high omega-3 fat containing seed, not the oil but the whole,
like flax seeds,
fresh ground, hemp seeds, chia seeds. But again, at one end of the spectrum, you've got somebody like Caldwell Esselstyn, who has as much proof as anybody ever on the planet for how to truly, reverse cardiovascular disease with diet. He is wanting people to stay at or around 10% fat, and recommends only for somebody with cardiovascular disease only the seeds, maybe a small handful of walnuts, which are the highest omega-3 containing nut. And if somebody has, again, already been diagnosed with atherosclerosis, no avocados, essentially pretty much no nuts, and otherwise zero oil.
Okay, so here's a question. Here's kind of a pointed question. No, it's actually not that complicated.
Right.
It's like it's kind of it's there's a lot of pieces, but it's well defined.
Ask your question, and then I want to return to one other thing after that.
Okay, so what about but Doc, like fish oil?
Right.
Fish oil is supposed to be really healthy for my heart.
Right. So again, truly a difficult question to answer in the sense that there is no definitive 100% opinions having been made on either side of the equation. There have been very large meta-analyses of studies that have shown little to no effect on cardiovascular mortality with the fish oil. My contention is I am a big proponent of having enough omega-3 fats in your diet, or essentially in your body. Right? So
assuming that the ones that go in your mouth make their way to the cells and whatnot.
I already said I'm a big fan of testing blood tests and different assessments with patients. So I do always follow essential fatty acid levels in their bodies and make adjustments based on what I see there. And it's very interesting. Some people's genetic makeup is going to allow them to better process plant-based omega-3 fats that you would find in whole flax seeds, whole hemp seeds, etc., down all the way to these fats that come in fish oil, like EPA and DHA, whereas other people don't do that very well. And it's also a fascinating little side note. If you don't eat any fish oil, if you don't eat any animal-based omega-3 fats, you become better and better at converting plant-based omega-3 fats down to EPA and DHA. Getting a little technical, but
yeah, we're geeking out here a little bit, which is totally okay, and I like it.
Good, but so to go back to the beginning of that though, for fish oil supplementation, honestly, my biggest concern is the nature of the fish oil itself. Number one, for certain genetic types, people don't think about it. Fish oil has a decent amount of saturated fat in it. And some people's genetic types do not handle that very well at all, period. And they will do poorly and look poorly on their labs, et cetera, even with fish oil. So that's one thing.
You're talking about the ApoE4?
Correct.
Okay.
Yeah, especially if they have 2 copies of the ApoE4. So that's one question. There's also a lot of concern in my mind about the potential for toxin contamination of fish oil, even if you have what you'd call like the high grade molecularly distilled fish oils that are sold by the big companies. There's research I've seen that there are certain chemical structures and weights to these different types of chemicals that all these fish unfortunately get so exposed to in the ocean that nothing removes them. So if you look in the right place, you're going to still find the presence of certain molecular weight toxins in even the highest grade fish oil. Yeah. So that's a problem. So that all being said, again, I do promote maintaining optimal omega-3 levels. So if I test somebody and what they're eating from their diet is not cutting it, they're doing the 2 to 3 tablespoons of these seeds a day and their levels are still really low, I will then recommend an algae oil supplement, which is grown in a controlled environment, no toxins, has the exact same omega-3 fats that are found in fish without all the negatives, and then you don't have to take it from a fish, and you don't have to take the fish out of the ocean and all these other things we don't have to get into.
Cool. Yeah, no, I thanks for distilling all of that for us. Yeah. I think that the health of the world really needs to be considered throughout all of this, which is kind of a whole nother topic.
Well, we'll be back talking about that one.
We'll be back on maybe the next episode talking about the world. But I always say that we can only individually be as healthy as the health of our ecosystem. Yep. And that's kind of deteriorating slowly but surely if we're not, doing anything about it.
Couldn't agree more.
So the fish, even in the highest sources, just gets more and more risky as time goes on. Yeah, you
can pluck a penguin out of the middle of, Antarctica and analyze their body tissue, and they're loaded with chemicals. So anybody that says, "Oh no, my fish is healthy because it's wild caught and it's from Alaska or whatever," it's like that is, for me, I feel the worst for the fish because they are like living in this soup of nastiness that we created and absorbing everything and bioaccumulating it in their tissues, and then it's an unfortunate situation from a lot of perspectives.
I kind of think it's sometimes ironic that we are kind of poisoning nature, and then nature is obviously poisoning us back in a lot of different ways through fish or toxic soils or waters or otherwise.
More to come.
So we kind of touched on some of it, but any favorite foods in your kind of cardiovascular diet plan?
Yeah. Well, I was going to kind of come back to another question which kind of would segue into that a little bit. In terms of all this, I think it's important to consider macronutrients, et cetera, especially when you're talking about something like cancer and tumor growth promotion and things like that, and protein intake. But I also try a lot of what I do with my patients is based on the work of these doctors that did really definitive research, but the reason why they did the research is because they looked at observational research and epidemiological research, looking at large populations of people who didn't get cardiovascular disease. Sure. And we're like, we have this whole group of Americans getting, 1 out of every 3 to 4 of us are dying of cardiovascular disease. And then you have evidence of, at least in the past, of these populations of people who literally didn't get any at all. And so from that perspective, they were just sort of observed, what are these people doing? And they weren't, these people, none of them, I guarantee you, were going on chronometer or something like that, and entering their food intake and making sure they were getting the right macronutrient ratios. They were eating a plentiful plant-based diet, and whatever trickled down into what macronutrient category is whatever it was. But what they did was, they looked at many different populations of people living in different parts of the world, and what they found was there was still the ones that didn't get cardiovascular disease. It still almost always trickled down to a very high carbohydrate, low fat, low protein diet. Anywhere from if you do go to the point of analyzing it, right around 70 to 80% carbs, 10 to 15% fat, 10 to 15% protein. So I think it's silly to try to argue against what's been proven time and time and time again. And so, a lot of these docs say, don't worry about it too much. Just eat a wide range of plant foods and get enough calories and you're good. And that seems to be how it plays out.
Yeah.
So then within that realm, in terms of therapeutic foods, absolutely far and away greens. And dark leafy greens are your blood vessels' probably best friends. And you could tack on to that high nitrate containing foods specifically that you need to chew in order to really get the best benefit from. So there are certain leafy greens that have higher amounts, like arugula is a really important one, and then beets and beet greens as well. Nitrates are going to help trickle down and get production of nitric oxide up higher, which is a crucial thing for your blood vessel health. So, but greens in general, if you stuck with whole dark leafy greens, raw, steamed, water sauteed, that's what you're trying to do. One of my mentors, Dr. Esselstyn, always says he wants his patients' blood vessels bathing in green vegetables all day long.
Yeah, no, it's amazing because it actually just hit me recently. The idea that this food that, it seems like common sense, of course, that the food we're eating is actually bathing every cell in our body. And that can become apparent when we eat something like beets and we pee red.
Very quickly.
We pee red the next day, or
asparagus, later, and you smell some interesting.
Because those nutrients are obviously getting broke down. They're making their way into the bloodstream. The blood obviously goes to every single cell of the body, right, and gets filtered through the kidneys. And there's still the red pigment enough to be showing up in the toilet.
That's an excellent point.
Yeah.
Excellent point.
So it's like, wow, it's kind of like common sense, duh, but it's like these foods are medicine to every cell of the body.
Absolutely. Yeah. Berries would be pretty high up there as well.
Yeah.
And then beans.
So when we're talking about like, a high carb, low fat, low protein diet, are you ever concerned about blood sugar control?
No, not if they are consuming purely whole foods.
Okay.
I mean, I have seen way too much evidence to the contrary in my own practice. If you have somebody who is an out of control diabetic, the most I would do out of concern is monitor. But I've seen a woman, on insulin, on metformin, fasting blood sugars, 2 to 300 in spite of that. Hemoglobin A1C at, 9.5, do 2 months where eating a terrible diet. The only change she made was she added a green smoothie in the morning instead of her normal crappy breakfast, with fruit and greens in it, berries, greens, and bananas or something like that. Pure, almost pure carbohydrate, you could say, and liquefied. And her hemoglobin A1C dropped 2 full points in 2 months.
Wow. Yeah.
With no other change. So, and I've seen, various other examples, but to sort of add one little piece to that, I think one of the most important things, other than obviously for the most part, we want to have it be whole sources of carbohydrates. You also have to keep your fat intake lower, because the worst problems happen when you eat a high fat, high carbohydrate meal at like the same time, because then you're going to muck with your insulin receptor site function and not allow your body to process the glucose properly.
Yeah, my understanding is, not only are we, mucking with the insulin receptor site function through the intramyocellular lipotoxicity, but we're also, metabolically speaking, just when it comes to like the food in our digestive tract and the enzymes that are used to break such foods down, we can't do it all at once. We have this metabolic priority, and when we've got fats and protein and carbs, something's gonna give.
Right.
But if we're just doing, a higher carb diet without the fat, then we are optimally metabolizing those carbohydrates.
I mean, there's even research that shows that insulin sensitivity improves with higher carbohydrate intake if you do it correctly.
Right.
Like literally over time in research studies, things getting better by adding carbohydrates to the picture. I don't know if do you know who Walter Kempner is?
Yeah, the rice diet. The rice diet.
Do you know what the breakdown of foods that those
rice, table sugar, and fruit juice, right?
Correct. Fruits, fruit juice, rice, and table sugar. Sometimes up to a quarter cup of white sugar a day.
So that's like 1% fat or something, or less.
It was basically ended up to be around 5 to 6% fat.
Okay.
Very 5%.
Hey, Winnie.
5% protein. She's a carnivore. She's like, what are you guys talking about? Carbs, pork. Come on.
She's rebuting.
And, people getting with severe end stage diabetes becoming perfectly healthy eating that. So not that I would ever recommend somebody eat a quarter cup of white sugar a day, but look at what's possible if you keep the ratios of everything else down.
Exactly. It's a terrible diet, terrible recommendation, but it just proves a point pretty clearly.
Yeah, you cannot. Yeah, you can. I mean, there's the movie What the Health, and a lot of naturopathic doctors and other health-based practitioners freaked out at that movie because there was parts of it where one of the interviewees said sugar doesn't cause diabetes, and it doesn't. Yeah. It will worsen diabetes.
Sure. Yeah, I always, I always say if you want to manage your diabetes, you should eat a low-carb diet. If you want to reverse your diabetes, you should eat a low-fat diet.
I would agree with that. With some obvious details plugged in there.
Yeah.
Very good point.
Cool. So where are we? How about so we talked about the foods to support that are on the diet nutritional plan for when it comes to heart health. Greens, nitrates, berries.
I like beans too.
Beans.
Good foundation.
Yeah.
You're going to eat more foods than that, but I'm trying to get people to eat all of those things every day. Yeah. Cool.
And I also really love Dr. Greger's Daily Dozen.
And
someone actually, a patient just told me that they try to follow that Daily Dozen, but they said they can't eat that much food.
Right.
Because, it is a lot of food to check off all those servings of whole grains, legumes, veggies, fruits, and
there's no better way to lose weight either, than a super high fiber whole food plant. It is hard to eat. Like I personally, similar to you, I would guess, I don't have a whole lot of issues with gaining weight. I am trying to maintain my weight, when I eat a really healthy whole food plant-based diet.
It's okay.
I have to make a conscious effort to get enough calories in. Because I get full so easily on all this fiber. So
and that's a really good point. I don't want to go off on too much of a tangent, but like 6 or 7 years ago, I was vegan, and I wasn't a junk food vegan, but I wasn't fully nutritionally awakened maybe to how I could best nourish myself.
Yeah.
And I realized I simply wasn't eating enough because I was, I don't know specifically what I was nutritionally deficient in, but I was, fatigued, anemic, just kind of basic stuff. And And then in naturopathic medical school, I hopped on the meat bandwagon and had some bone broth, and I felt like totally revitalized, energized, and I was like, oh my gosh, I was missing something.
Right.
And was only eating kind of a low meat, moderate meat diet for a year or so, and then I kind of just weaned myself off slowly, just not really mindfully in any sort of way. I have since become more mindful of the environment and everything. But anyway, I realize now I'm like more nutritionally aware of how to actually eat a comprehensively nourishing whole food plant-based kind of thing.
I mean, it's interesting because I hear frequently from other colleagues like, oh yeah, the sickest patients I ever see are vegans, and therefore I'm writing off the vegan diet. And it's it's a perfect example. My first question is, well, what were they eating? And what were they not eating? You know, and it's just so if somebody's going to eat that way, and again, this is not to say people should only eat a vegan diet or whatever. At least for health purposes, it's not 100% necessary. But if you're going to do something close to that, you definitely want to get the right resources. And Dr. Greger is a great one, and but it's fully possible. And but the one other point is the calories are crucial. And people always freak out about protein intake. And if you eat a whole food plant-based diet and you eat enough calories, you cannot become protein deficient. It's just essentially impossible.
Protein isn't a fuel source, so it's, we're not burning protein.
You might not be able to become Arnold Schwarzenegger, or at least before he became vegan, and get muscles that big on a plant-based diet with that amount of protein, but you can certainly maintain health for sure.
Cool. How about, we can just kind of skim the surface of this one unless there's any reason to go into it, but any foods that are like totally to avoid 100% when it comes to heart health?
Right. So I will try to answer all these questions from like, if somebody has either, very, very strong predisposition and or already been diagnosed, like they got work to do, definitely added oils, and then saturated fat would be the top of my list, and keeping animal protein to a minimum.
Sounds good.
And no Twinkies.
No Twinkies. We all agree on that. Luckily, we can.
I don't know. That's just the first one that pops into my head. That's like
careful,
disgusting. Winnie. Oh, look at
that. Okay. Winnie, you doing okay? It's okay.
Oh, here's my other side.
Here's the cat butt. All right. Okay, so how about supplements? I'd like to talk supplements. When do they come into a plan for you?
That's a good question. I come from, again, a varied background in nutrition. Not just food. And I'll just answer this to everybody out there. So the first thing I would say is you cannot argue with the fact that you can reverse cardiovascular disease essentially with food alone. So other than vitamin B12, which all 100% plant-based people should take as a supplement, in my opinion, there's well-proven evidence that you do not need anything else if you do everything else right with your food. So, but in my world, I have also learned from other backgrounds in nutrition, orthomolecular medicine, people like Linus Pauling and Alan Gaby, and some very well-known nutritionally oriented doctors, and about some amazing effects that certain nutrients have, certain specific nutrients have on cardiovascular disease. And in my opinion, there's a potential to augment and even improve upon what's been proven already by doctors like Dr. Esselstyn and Ornish and things like that. So it is a lengthy topic in terms of why. But I would say if I was to pick, top 3 nutrients as a supplement to add to somebody's program, trying to prevent or reverse cardiovascular disease, B12 aside, because again, that's just kind of a prerequisite, I would say vitamin C, magnesium, and then probably vitamin K2 beyond that.
Not D.
I'm not anti-D. I think D is overdone. I would certainly prefer somebody get sunshine if at all possible. I'm a proponent of vitamin D lamps as a alternative to oral supplementation. I think there's still a lot of question marks out there. There is some interesting research on vitamin D and cardiovascular disease, and so that would be one of the ones that I would recommend as needed, depending on what patients' levels were and what their environment was, whether or not they could get sunshine, etc. I think my personal opinion is human beings are not designed to consume much vitamin D orally. We are meant to make it. So I'm going to try to get people to do it that way if possible. But in terms of consumption of supplements, C and mag are top of the list, in my opinion.
Is there any symptom or sign that would point you to lean on vitamin C or magnesium specifically? Like what would call out to you, like, give me vitamin C, give me magnesium?
Right. Well, so again, I think you can get a sufficient amount of vitamin C for general purposes through a well-planned diet. Magnesium is becoming tougher and tougher, regardless of how healthy your food is.
Tougher and tougher. Why
more
is
difficult that? Just because of it's frequently going to be depleted in soil unless there's really specific steps taken in the soil that people are growing their food in, which is unusual, for the vast majority of people. There's a high potential for magnesium deficiency in their diet, and then also the stress levels that we're under cause us to lose a lot of magnesium, like an unnatural amount, in my opinion, because it's unnatural amounts of stress. So it just is so frequently comes up as an important thing and has been so well shown to help with cardiovascular disease prevention in research. So in terms of what I would see in a person, if somebody comes to me and they are in fact a human being, I would say they need some vitamin C.
Well, vitamin C as well, like magnesium, is used under stress.
Absolutely,
yes. The adrenals
yes.
just kind of like soak that stuff up.
Correct, and we become quickly in need of more. And our things that are in need of repair, like blood vessels and things like that, do not get the apportioned percentage of vitamin C from our diet that they need to repair themselves if we don't have a high amount. So it's not to say that everybody has to have it, but if I'm going to try to augment a plan, I'm probably going to be adding some vitamin C, just because human beings are not capable of making it like most other animals on the planet, and we are in such frequent need of it that it's a likely need by people. And then magnesium, there's not a lot of symptoms that you would get from the reason why I answered the question like that for vitamin C. There's not a lot of symptoms that would strongly suggest
scurvy.
Yeah, unless you start to get really low in it and you start getting, bleeding gums and bruising and poor joint repair, etc. But in general, I think most people could use at least a little bit. Magnesium's a little bit easier. I see people very frequently that need magnesium, and the classic things I see are muscle tension, twitchy muscles, twitchy eyelids, things like that, tendency to muscle spasm, sleep trouble oftentimes, and then anxiety or stress intolerance would be definitely the most common symptoms that I see that would make me go, I wonder if you might benefit from.
And can you talk for just a second, because you mentioned it, K2?
Yeah, K2 is interesting. Technically, as far as I understand it, and I would not say I'm a world-renowned expert on vitamin K2 by any stretch of the imagination, but as far as I understand it, if all circumstances are as they should be, and we're eating a very appropriate diet with tons of fiber, and we have the then appropriate types of microorganisms in our gut doing the things that they're supposed to be doing, we should be able to get vitamin K2 from what they synthesize and absorb that into our bodies and not necessarily have to consume much of it. It is present in fermented foods of various kinds, at least in a small amount. So, and you don't need much of it. We're talking microgram doses to get enough to benefit from it. But many people don't eat that way and don't have good gut microbiomes and aren't eating fermented foods. So it's in all likelihood, it's a fairly common need for people, and it's intimately involved in the process of calcification of arteries. So when vitamin K2 is present in appropriate amounts, we tend to not we tend to put calcium where it's supposed to be, and it doesn't tend to collect where it shouldn't be.
Yeah.
So I mean, again, I don't think it's a absolute necessity, but when you think about the average Western person, it probably is.
Yeah, but once you clean up the gut, are eating the diet that we've been talking about, probably not. If I'm hearing you correctly.
And in all honesty, the average person I see, I ask if they're going to really do what I'm asking them to do. They have a serious problem. They're going on a full 100% plant-based diet. I'm just going to ask them to take a high-quality multivitamin that includes some K2 in it. It's probably some of the nutrients in there are definitely unnecessary when you eat that way, but I don't like people having to swallow a lot of pills, and so I'd give them that to make sure they're getting enough iodine, to make sure they're getting enough, at least a little bit of vitamin D, B12 for sure, K2, just so it's almost like an insurance agent or something like that, where it's not loading them with massive amounts, but it's just sort of covering those bases so we don't even have to worry about it.
Yeah, it's just like putting a coat of like a protective layer on the plant. Right.
Yeah. And I see no reason. I mean, you can be if you want to be like a purist and say, well, I don't need any of that. I can get all this. I can get healthy with nothing but hopefully B12. I'm not going to argue with that because I do believe that's possible. But it's an unusual person who's going to take the steps necessary to cover all those bases every day. So on and so forth. Yeah,
this is good to hear, especially for me personally. I think, in my personal life and to some degree in practice, I think that using supplements is such a crutch, and I try to avoid doing it at all costs. And but it's from what I'm hearing you say, it's like we are living in this world. People are living in their stressful lives. We do have nutrient depletion in the soil. These things are real. Yeah. And it's kind of just bite the bullet, swallow the pill.
Yeah, it's real. It's realistic. And when I first graduated from school, I was so like, you don't need anything but diet and hydrotherapy, and that's possibly true, but it's an unusual circumstance where you're going to have somebody be able to do everything else in their lives to make that true. Yeah. So it's a simple thing to do otherwise, and it just makes it, to me, it helps. What I want them to do more than anything is sustain their main dietary and lifestyle changes in the long run. And I don't want something to derail it that had nothing to do with the diet, really, because you see that happen all the time. Oh, it was the vegan diet or whatever. It was like, no, you just weren't taking B12, or whatever it is. Yeah. So,
yeah, I do want to talk for a second about B12, because it's my understanding that B12 kind of historically was, people were drinking water with bacteria in it and eating more dirt and like just getting more of the bacteria in their system that were the B12 producing bacteria. Is that true to your knowledge?
Absolutely. Okay. And people, the average person is going to say, oh, well, vegan diets are unnatural because you have to consume B12, which is present in meat. Well, it's present in meat because those animals also were exposed to the same bacteria. Yeah. But it's the bacteria really that it comes from. It's not synthesized in an animal's body. Yeah. And so yes, it is true that humans used to not, clean and, whatever, deodorize and all the things that they do to their food these days, to the extent that all of that bacteria was washed off. They pulled stuff out of the ground. They drank water, all of which was laden with some amount of bacteria. And when you look at it, vitamin B12 has the lowest actual amount requirement to maintain health. It's like a less than 10 micrograms a day.
Yeah,
it's a minuscule amount.
If you get a B12 dropper, you can take like one drop like a week, right?
Right.
Yeah.
For the average person, there's definitely, we always check labs.
Yeah.
We always pay attention because some people clearly don't absorb it as well as other people.
Yeah.
Some people don't shuttle it as well as other people. So I always go first by what's in front of me with the patient, and then backtrack from there. But yes, the average person, you once a week for sure would be enough of one of these supplements. Yeah.
Cool. Next question is just more curiosity to me, and I could probably guess it at this point. But if you could like drop one of these supplements in the water supply to kind of get to every human being across the country or something, what do you think like everyone could use some more of?
That depends on if you're talking about the thus far non-existent world of everybody eating a mostly plant-based diet. If that was the case, I would put B12 in the water supply.
Which is funny because that's like bacteria.
Right. I would just put bacteria in the water supply.
Yeah.
No, but that aside, it would be a toss-up. I would probably put magnesium in there because it seems harder to come by if somebody's not willing to supplement.
Yeah. Yeah, and it's funny because obviously in today's world, we need to work on taking things out of the water supply, not putting things in.
Right.
But I just was
that's
curious.
a good question.
Yeah.
You should ask every doctor you talk to.
Yeah. Well,
I bet you're going to get a lot of vitamin Ds.
Yeah, especially in our northern latitudes and yada yada. Another question that I'm curious asking other doctors and health people is how would you define health? It's kind of late in the conversation to bring that up, but like what is health?
Well, I think health is far beyond the absence of disease. That's how conventional medicine seems to define it. Like if you don't have something that's actually killing you, then you're fine. Come back later. I think health is a state where you are thriving in the sense that you have all the energy that you need to do what you want to do in the day, and you live a life that you enjoy. It's far beyond not having symptoms. I don't think anybody's ever asked me that question before. But I guess I would just say, living to the greatest potential that a human body can attain realistically. I think we're far below that. I also think it's important. People sort of equate this idea of lifespan and health together. Totally. And you have some people arguing, oh, well, humans these days are living longer than they ever have pretty much, so we must be as healthy as we've ever been. Well, no, that's not actually true, because we also have the most...
walk down the street and that's really
right,
not true.
and we have the most years now of living with disease and suffering than we ever have had.
Hence the exorbitant healthcare bills.
Yeah. So real health is like maintaining function and engagement in your environment and contributing positively to your world for as long as possible.
Love it. Yeah.
How about that?
Yeah. I also like the words that you use, like which was realizing your optimal potential kind of.
Yeah.
So beyond nutrition, which has been kind of the focus of the conversation, which is great. This is, believe it or not, the first nutritionally focused conversation. More to come. But beyond that, like what ingredients are there into health or realizing optimal
like actual
potential?
practices
or whatever.
So food is certainly the foundation, in my opinion. I think movement deserves a mention, even though everybody already knows, exercise is good for you, but there's some new stuff that not necessarily everybody's aware of that I really try to promote with my patients, which is moving frequently. We are not, as a species, designed to sit. So not only do we need exercise, it is bad to sit for a long time. So they've done research where they've shown they take one group of people and they have them do 60 minutes on a treadmill at the end of a day of sitting at a cubicle and doing work. And then they have a second group doing whatever, maybe 6 separate 10-minute walks on a treadmill interspersed throughout their 8-hour cubicle day. And they measure all these parameters, and these people do clearly better, even though they're doing the exact same amount of exercise as these people. Yeah. So there's something to not sitting for too long that is very important to do. So I literally have my patients set an alarm on their phone, goes off every hour or two, they get up and do some stuff. And then, the whole idea of positive mental attitude, having faith and belief in something, having a purpose, those cannot be understated, and I'm a big proponent of them. They're not what I would call my area of expertise either, beyond, being aware of the importance of them. Getting outside, breathing fresh air, seeing green things, seeing blue ocean, and then definitely community and regularly engaging yourself with people that you enjoy being around and that make you feel good and that make you laugh and forget about stuff, is all so important. I mean, you could go on forever with there's so many good things that we could be doing for ourselves, but those are some of the main things that I think of. I'm a very big proponent of Dan Buettner's work.
Totally.
So the blue zones and everything that they came up with, it's kind of like we have it all laid out in front of us, what we really should be trying to do. It's not rocket science. It's just like live like humans are meant to live, and not sit in a like a little cage with artificial light, breathing artificial air, eating artificial food, and not talking to anybody, and not moving and expect to be healthy. It's like,
and then we wonder why we've come into the state of health collectively that we are today.
I'm astounded at how well we do in spite of that.
Humans are it just goes to show you, humans are resilient.
It does not take much. I tell people that all the time too. People are sick and not doing well, and come into my office and I'm like, all your body needs is a chance. It needs just a little opportunity, and it has this amazing capacity.
I love the simplicity of it's such a great reminder. It never gets old how simple and clear.
Like I said, I'm like 19 years in practice. My recommendations are getting simpler. And I'm focusing more and more on thorough application of the most basic things rather than like do this, and do that,
Well, I'm not 19 years in practice, but I think that I'm starting simple, and
lucky you.
It is interesting because I find, I don't know if you have this experience, but I find that people actually like to complicate things, and people, there's so many ways that it takes place in the world, but people want complex mechanisms and strategies to do the most simple things.
And maybe that's a result of how boring their lives are. I mean, you just think about like somebody whose job it was, so to speak, to get up and go figure out how to live the rest of the week by getting enough food and making sure everybody's protected and going and deciphering which plants are going to kill me and which ones aren't, and all these different things. There's so many different things to do in the day from that perspective that are so important. And now it's like we're like it's like, so there's that. And then to me also, you have these people that have type A personalities, and they're like, okay, I'm going to do everything you tell me, and then I'm going to go learn 5 other things from this source and that source and do those too. They get overwhelmed.
I mean, I can speak for myself. I feel pretty addicted to stimulation a lot of the time. I mean, just last night I was sitting down, I closed my computer after, some work and some writing, and I just kind of looked after like 10 seconds, looked around. I was like, now what? You know, like,
right.
you know, where's the
Yeah.
phone? Where's the,
Yeah.
and,
yeah.
you know, I think,
Ugh.
yeah, I think it's just so great to kind of create an environment, at least for few minutes a day, where you're just engaging in the most simplest
Yeah.
of
So
life's
hard.
tasks. Yeah.
You literally I have to force myself. I have
Yeah.
to like leave my device or whatever where I can't get to it.
Yeah.
Yeah.
Simplicity doesn't come easy.
No, even though it does.
Even though it does. It's a great paradox.
Yeah.
Well, how about, you know, on that note, any kind of words of wisdom for anyone who's moving into the actualization of their optimal self when it comes to health, nutrition, or any other means?
I would say, I think far and away the most important thing is to not do what somebody else tells you, but to learn what to do yourself. Now, you can certainly have somebody guide you, which is what I do, which is what I know you're doing. But self-empowerment and understanding and believing that you have the capacity to fix yourself is crucial. And you cannot do that without knowledge, you know? So if somebody's going to really truly try to go down a road where I want to get healthy, you got to learn how to do it yourself and the details of how to do it on a day in and day out basis versus just checking off a list. I took that, I took this, I took that. Okay, I hope everything turns out well. Like that doesn't last very long. And that's not, you know, Dean Ornish, I love his work, and he learned through the work that he did that you cannot expect fear-based recommendations to last long with people. So if you're telling somebody, if you don't take this, you're going to get sick, or if you don't blah, 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 it doesn't work very long. It's more about showing people that, you know, teaching people how much power they have inside of themselves, you know, and how it just, your body's just looking for an opportunity, but you have to learn what it needs, you know, and learn how to live it. So it's not an easy thing, but being healthy and getting healthy when you have a serious disease is not easy. And any doctor that tells you, oh, this will be no problem, they're trying to pull a fast one on you, because it's going to take a tremendous amount of work and effort and knowledge, but it is possible. So it's a I don't know, it's a tough situation, but that's what you got to do.
Yeah, no, I love the way that that you put it. Yeah, I don't even know if I want to add anything to it. It's like what I hear is, you know, there's no easy fix, and it's an inside out kind of job, not an outside in kind of job.
But just like naturopathic medicine says, trust in the healing power of your body. That is the foundation. You have to believe and adopt an attitude that if I'm breathing, I can heal, you know, and then find the ways to support that as much as possible.
Love it. Well, I think that's a good place to end.
All
if
right.
you want to just end with, you can share, you know, who you are, where we can get more information about Dr. Daniel Chong.
Yeah. So my primary avenue of trying to help people these days is through a business called the Healthy Heart Academy. And so you can find me at you can find the work I'm doing at healthyheartacademy.com.
Awesome.
Thank you, sir.
Thank you, sir.
Yes. Good times.
Peace and love to you. Take care, everybody.
Thank you.